Hey everyone, Dr. Charlie Johnson, physical therapist at Physical Therapy in Johnson, and in a previous video I talked about the different types of hip pain. I want to bring you through two simple self-tests that you can determine to tell whether or not you might have a weak and painful hip. So you're testing the strength and you're looking for strength and control in these two simple tests that you can do at home. It might be helpful to have somebody watch you, or maybe do this in a mirror, or maybe take your little flip phone and have somebody record you. But the first one is literally just going to be a little step down test, okay? And then we'll go through the second one. So the first one is a step down test. I'm going to move my head out of the camera, and I just want you to watch the position of my hip, knee, and ankle. Hopefully you can see that, okay? So again, the first one is a step down test. So you're going to do this on the side that doesn't hurt first, so you can get an idea of what you're feeling, okay? And what you're going to do is you're just going to take your leg, okay, and kind of move it out to the side, all right? Kind of slide it out to the side. You can even slide a little bit out front if you want, okay? And what you're doing is you're just kind of seeing how easy or how difficult this is, okay? And you're going to get an idea of how that feels baseline on your good side. Now let's just say this is the side that I had pain or problems on in my hip, okay? What you would do is you would do the same thing, okay? And what you might notice is that this leg, you either have to lean excessively to that side, okay? Or this leg really kind of caves in, okay? If your leg is excessively caving in on the side where it hurts compared to the other side, and or you have to really lean over that side to kind of help yourself keep balance, or it just doesn't feel as strong, then chances are you don't quite have the strength in the one leg as you do the other leg. And you might even know that when you're doing it, it's painful, okay? The second test is a single leg or a one-legged bridge, okay? So what you're going to do is you're going to lay on your back. And again, you can try this on the side where it doesn't hurt first, okay, and just see. But what you're going to do is you're going to do this on the side where it doesn't hurt and time it, okay? So I need you to take like a stopwatch, and you're just going to time how long you can hold this position. So here it would be, okay? So you're going to lay down on your back. Hopefully you can see this. And you're going to have both knees kind of bent up at just like a comfortable angle, okay? And you're going to hold the one leg straight up, and then you're just going to bridge up. And you're going to hold this position. Try not to let the boat rock, so to speak. You're going to hold this position, and you're just going to time it. You're going to time it. You're going to go as long as you can until you fail or you can't hold it any longer, okay? And then you do the same thing on the side that feels painful. And you might notice that you just don't quite have the juice, you don't quite have the horsepower in that side that's painful as compared to the other side. And you might notice that if you look at your stopwatch, you can hold it for a minute on one side and only 30, 40 seconds on the other side. So you can be objective about it and write some numbers down and clearly see that the one side is not as strong as the other side, okay? So hopefully this helps you determine whether or not one side might be weaker than the other, and if weakness and or a weak and painful hip might be the cause of your issues, okay? So if you want help or have more questions, reach out to us, 484-552-3767.